Hey, hello everyone, and welcome to yet another Two Talk with Your Dentist on thedentaire.com. I'm Dr. Rekha, and the Two Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, and on Telegram. And in conversation with me today on the Two Talk, I have Dr. Ravindra Savadi. To give you a brief introduction about Dr. Ravindra Savadi, Dr. Ravindra Savadi is a professor of prosthodontics and practices exclusively at Savadi Dental Care. He has just completed his tenure as the president of the Indian Prosthodontic Society. Dr. Savadi is a graduate from the VS Dental College, Bangalore, and did his post-graduation from the Government Dental College, Bangalore. He has over 31 years of experience in clinical practice, and he has several publications in national and international journals to his credit. Dr. Savadi was formerly the head of the Department of Prosthodontics at Oxford Dental College. He has been the examiner both for the undergraduates and the postgraduates at the Rajiv Gandhi University of Health Sciences. He is the past editor-in-chief of the prestigious Journal of the Indian Prosthodontic Society, and he has been an active member of the Indian Dental Association for the past 30 years. He has held the post of the president of the Indian Dental Association at the Bangalore branch and the Karnataka state branch, and also at the national level. He has been in the organizing committee of several scientific conferences as a convener, member, and chairman, and conducted several hands-on programs in prosthodontics. He has been a member of the board of the PG studies of the Rajiv Gandhi University. Dr. Savadi has been a keynote speaker and a guest speaker at several conferences all over India. He was awarded the prestigious S. Ramchandra Oration Award by the IDA Karnataka branch in the year 2010. Hello, sir, and welcome yet again to another Two Talk with Your Dentist conversation.
Hi, Dr. Rekha. Nice to be here. Thank you once again for having me.
Thank you, sir. Thank you. I just thought today maybe I would act as a patient. I would be the patient and probably ask you some doubts and queries like how a patient would probably want to know answers to.
Yes.
Okay. So, sir, my first question: which is better? Is it better to retain a natural tooth or to have an artificial tooth?
Always retaining a natural tooth is good. It should be something like the perpetual meticulous maintenance of what remains rather than the often keep on replacing the what is missing. So meticulous maintenance of what remains is most important.
So any day maintaining and trying to save a natural tooth is any day better than removing the tooth and getting a replacement.
Absolutely.
So unless it is inevitable that the tooth cannot be saved and nothing can be done, it is any day better to save a tooth.
Yes, yes. Prompt maintenance is most important.
Most important. Okay, sir. I think some of the patients wonder when dentists make dentures. They probably sometimes think that extracted teeth, that the teeth we remove from other patients are used to build their dentures. Is that true or false, sir?
Nothing further away from the truth. It is so false. Now, it is not possible to remove somebody else's tooth and then make this one. Basically, the natural tooth has its own complexities, and it is best when it is alive and vital in the oral cavity. Once it comes out of the oral cavity, the blood supply is lost and the pulp becomes dead and the tooth becomes brittle. So, and then since the blood supply is lost, the pulp is dead. The tooth undergoes necrosis on the inside. The pulp tends to undergo necrosis, and there is going to be change of color. So it is just not possible to use another this one, and it is not ethically. It is not the way to go about it.
Yes, sir. Yes, sir. So we have what we call as fabricated teeth, acrylic teeth that
acrylic teeth, cross-linked teeth. So basically, acrylic is used, and it's a different procedure altogether. And the teeth are all different also.
Yes, sir. Yes, sir. And sir, patients might think dentures getting a denture done is expensive. Is that yes or a no?
Dentures, like anything else, can be done in various kinds of categories. This will be dependent on the materials that the dentist is using and the skill of the dentist also. So, if you have a dentist with a lot of experience and a lot of skill, given having performed many denture rehabilitations, hundreds of dental rehabilitations over decades, then definitely he cannot charge. He will not charge you the same as what a young novice will be doing. We ourselves have gone through that process of what we were charging 25 years back. We cannot charge the same thing now. And then it also depends upon the quality of the materials that is being used. There are many local materials which are used, and then there are German materials, Japanese materials. There are good materials. So depending on that factor, also the charges is going to vary.
It's going to vary. Yes, yes. And sir, if we have to consider a removable denture versus a fixed denture, which is better?
A fixed is always the treatment of choice. You don't want to keep removing it, and you don't want to keep putting it back into the mouth. So that is always the treatment of choice. Removable, you have to remove it in the evenings before going to bed, and then put it back in the morning. And every time that you insert it, it is going to brush against the adjacent teeth and go inside. Every time you remove it out again, it is going to brush against the adjacent teeth. This itself will weaken the teeth. So food lodgement is going to happen if you're going to wear it for 12 hours to 14 hours a day. Food lodgement is going to happen. That is going to eat away the adjacent teeth. So always the meticulous preservation of what remains is more important than the perpetual replacement of what is missing.
Yes, sir. Sir, considering these days we have another option of implants, that is a single tooth replacement that is available. So, what would you say if it is an FPD, a fixed a bridge versus an implant?
So I have a fixed bridge here. I just picked up a model of this. So let us say this is a missing tooth here, and when we do a bridge, we are going to take the support of the adjacent tooth. You're going to take this tooth out and make this tooth small. Now, mind you, these are intact teeth. They're good teeth. Everything is fine. Nothing is wrong with them. We're going to include this, and then put a bridge on top. So this is going to be the procedure. So this is not required because when a single tooth is lost, you're going to take the additional 2 teeth also. So rather than this, retain this as it is, and then put an implant inside. Retain the implant in place there itself. And using this, you are going to put the tooth on top. So this is a simple way of doing it.
So for a single tooth replacement, any day, in terms of the health of the mouth, an implant is any day better.
Single tooth, multiple tooth, any number of teeth, all the teeth, implant is the material, is the suggested treatment option.
Yes, yes, sir. And our patients may think, do dentures, wearing of dentures, does it reduce the ability to eat?
The wearing of dentures will reduce the ability to eat. Basically, a denture is going to be very different from a natural tooth. So natural tooth now, supposing I touch here, it has got nothing to do with any other part of my teeth. Each of these natural tooth, now supposing this is there. So each of these natural teeth have their own roots. So the roots is here, the root is here. Let's assume this is also a natural tooth. So whatever I do with this, nothing is going to happen to this. This is having its own foundation, this is having its own foundation, which is very different when you compare it to a denture as such. So in a denture, it is all the teeth are there on one common base. Now I lift this part up here or touch it here on top. So the entire denture is going to rock. So while eating with the natural teeth, if you eat on this side, it is not going to matter to this side of the teeth. But in a denture, you eat on this side, you put pressure on one side, then if this is pressure, then the other side gets lifted up. So you have to eat on both the sides. And denture has its limitations. In the upper denture usually stays well. The lower denture does not stay so well because the tongue is also moving around here. The tongue is always active here. This can get lifted up. And the patient should make an effort towards retaining the denture. First, get used to retaining the denture. Only then the chewing can happen. So chewing definitely is not. It is not as simple as retaining the when eating with the natural teeth. Definitely not. It requires some amount of unlearning and learning in the beginning. But subsequently, old denture wearers, we know that they can chew anything and everything that they want to. So they can eat anything and everything they want. They want to eat murukku, they can have murukku. They want to, people that I know eat bones. So they can manage that. It is going to be a little bit of a learning period.
Learning, learning. So that's basically some amount of training both for the cheek muscles and the tongue muscles to get used to
Yes.
a foreign body being in the mouth and training.
Cheek muscles, tongue muscles, and lip, and of course, the most important thing, the mind. So mind also needs to get
Yes,
itself understood.
yes, yes, yes. Sir, and if I were a denture wearer, should I remove my dentures at night?
Yes, you should remove your dentures in the night, basically because the tissues require rest. The tissues require to remove the denture and then massage the remaining tissues. Wash the denture, put the denture in a bowl containing water. Get up in the morning again, massage your tissues along with you can use a toothpaste also, and then clean the denture with a denture cleaning brush and soap, and then put it into the mouth. Tissues must require rest. They should be as good as what they were feeling earlier.
Okay, okay. Sir, and if I had a tooth removal done, should I wait before I get my dentures done?
The dentures, it has to decide upon what kind of a denture that is going to be done. So if it is a single tooth removal, then definitely we don't suggest going in for a denture. We would like to go in for an implant. Implants can be done immediately also. If there are all the teeth are removed and then you want to go in for a denture, there are two types of dentures. We can go in for a immediate. I'm talking about a removable denture. Again, implants can be used for all the teeth. So I will not go much into that implant part. So when you remove all the teeth and go in for removable dentures, then you can get an immediate denture done. That will require some time, but then this immediate denture will have to be changed, maybe about 3 to 4 months, or even 6 months also. If you can change it, that is good. Basically, because when you remove the tooth out, the socket is there open as it is, and then you put a denture on top of it. The socket tends to constrict, become small. The denture is going to be the same, so there's going to be an ill-fitting denture. It's not going to fit. So once the sealing is complete, then if you do a new denture, then the contact is going to be better.
So that means, sir, sometimes if patients cannot, suppose there are some people who are in the public view and they cannot afford to show people that they have lost teeth, then possibly in such a scenario, before the tooth removal is done, the dentures can be prepared and immediately the dentures can be given. But
Correct.
like you said, like at a later date, they may have to go for other replacement options.
Or if they want to go for implants, then immediate implants can be done and
Can be
teeth can
done.
be done immediately. Immediately, it will take a 2 3 days. It's not immediate, but two
Yes,
or 3 days it will take.
yes, yes, yes. Sir, and then are bridges permanent?
There is nothing permanent in the world. So bridges, if you are getting a bridge done on this tooth, if you're getting a bridge done on this tooth, this is supported by the natural tooth inside. It depends upon how well the natural tooth is kept. If the person could not retain this missing tooth itself, then what is the guarantee that he can retain the natural tooth? So there is nothing that is permanent, and I would not give an assurance or a guarantee on anything. But usually nothing will happen. Usually nothing will happen. It doesn't mean that just because I said nothing is permanent, it doesn't stay in the mouth at all. But usually nothing will happen. At the same time, I would not give a guarantee on anything. If by chance any dentist is saying guarantee of 20 years, 30 years, outright he is lying. He wants to market his product. That's all.
Okay, sir. If we said that about bridges, what about implants? Are implants permanent?
Same issue. Again, implants will usually nothing is going to happen. But the success rate worldwide, whatever that has been studied, is around 97 to 98% success rate of an implant. Usually nothing will happen, but then the implant is again placed in a person who has lost his teeth. He has lost his teeth because he has not been able to maintain the teeth. The same thing has to be, might be a problem with an implant also. So care must be taken. And again, having said this, usually nothing is going to happen, but no guarantee can be given on any of these things. You can, you can buy a brand new car costing 2 crores, 3 crores, maybe more also. But then they can be replacement of parts. There can be an assurance by the dealer. But then there is no guarantee that nothing is going to happen.
That means regular maintenance is what is important, and everything has a life.
Yes, absolutely.
Okay. So one last question, sir, in today's thing. Will my dentures break?
Yes, of course, it can break. Unless it is made up of a plastic material, which is a nylon type. So, in which case, it is not exactly the right way to do the denture. Like, it doesn't fit as well for a complete denture. But dentures can break. The teeth are made in acrylic, teeth can break. So, just because my head is strong, I don't want to go and hit it against a stone. So, that is what I always say. So, dentures can break. You need to take care.
Okay. Okay. So I guess I just came to an end of all the questions that I had for this session, sir. And thank you so much for clearing the doubts on probably some very basic doubts our patients might have on dentures and their characteristics and their properties. So thank you so much, sir, for joining me today in today's Truth Talk conversation. And I hope I can get you back to talk to our patients on another topic on dentures and oral care.
I'll be more than happy to do it. Thank you.
Thank you, sir. Thank you so much.
Thank you.
Viewers, that was Dr. Ravindra Savadi, who did talk to us about some common misconceptions or misbeliefs about dentures and denture care. I hope that was helpful. If you have any doubts or queries, please feel free to write to us your doubts and queries, and we will get back to you on that. For more information about your oral and dental health, do visit our website www.thedentaire.com and subscribe to our YouTube channel. And you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. And if you want to get in touch with Dr. Savadi, his details are given below in the description box. So until next time that I come back with another dentist with another topic on your oral and dental care, keep smiling, stay safe, and be happy. Thank you.